Hi, my name is Laura Simon, and I wrote Nerve because I knew my son never would, and I believe it's a story that needs to be told. At 19, my son, a Juilliard percussionist, went to the hospital for a chest pain. It took less than 24 hours in the hospital for my teenager's world to come crashing down. Adverse reactions to inappropriate use of antibiotics and medications led to a downward health spiral, causing paralysis from the neck down, the need for life support, and a struggle with life-threatening hospital-acquired infections. I was shocked to learn that it's estimated that 50% of hospital patients are given antibiotics that are not needed or inappropriate for the infection. I was so grateful for the medical care my son was receiving. I believe they were saving my son, that he was fortunate to have been in the hospital when he started to have trouble breathing and started to become paralyzed. I could never have imagined that treatment in the hospital might have caused his medical issues. Johns Hopkins study showed that medical errors occur so often in hospitals that preventable deaths due to medical malpractice are the third leading cause of death in the US, just behind cancer and heart disease. But this book is as much about what went wrong as what went right. My son's indomitable spirit, the strength he had that pulled him through some of the darkest times. He fought with steely resolve to get back on his feet again, to get back to his music and his friends, the life he loved so much. Only my son could have saved my son, but there were so many people who stepped up to give him strength, to keep his spirits up, to help keep his energy moving forward, and were fundamental to his recovery. I hope this book resonates with anyone who's seeking a story of hope in a challenging time. And I hope this book appeals to parents and caretakers, young people, those going through their own health struggles and challenges, and anyone who'd like to learn more about the downsides of antibiotics and medicine and what you might be able to do to protect yourself. This book too is for doctors and nurses and really demonstrates the vulnerabilities of a patient, what it's like to be stuck on a hospital bed, unable to communicate and at the mercy of the hospital. I think Dr. Alon said it best. Do as much as you can for the patient, but do as little as you can to the patient. Thank you so much for listening, and I hope you have the opportunity to read my book.